At ITRT, we manufacture advanced cell therapy medicines. Each one is individually authorized by the Spanish Agency of Medicines. The procedure begins in a hospital operating theatre. Sterile clothing, asepsis and antisepsis. Sedation. The field is prepared over the pelvic area with the same level of sterility as any hospital surgery. Mesenchymal cells are obtained from the bone marrow to serve as the raw material for the medicine. It is a minimally invasive extraction performed under sedation. From here, everything that follows depends on the care with which this sample is obtained, identified and preserved. Each sample is identified with the patient's details, date and centre of origin. It is the first step of an individual traceability that the Spanish Agency of Medicines, the AEMPS, requires for each batch. The sample travels to the manufacturing laboratory in a validated container between 2 and 8 degrees. A thermal recorder verifies that the temperature is maintained throughout the journey. Each shipment is documented. If at any point the cold chain is broken, the sample's discarded without exception. 21 days in a clean room. Under pharmaceutical manufacturing standards, the cells are expanded and characterized until the dose of the medicine is obtained. 3 weeks later, the medicine is ready, and a second intervention begins with the same team, the same environment, and the same rigor. A single identified batch with a 72-hour shelf life from its manufacture. Ultrasound-guided application. The medicine is administered at the exact point of the injury. What you see lasts seconds. What makes it possible are years of work, certified pharmaceutical facilities, and a demanding regulatory framework.